Today I am going to explain how to consume the miracle drinks, health supplements, products. As per the health guide or doctor prescriptions, morning in empty stomach, you have to consume all the health supplements in one go. And thereafter, you take prebiotics. As you know that prebiotics basically nourishes the gut microbes. That is garlic. Garlic 2 to 3 pieces, and secondly ginger sliced ½ inch or 1 inch, and fenugreek seeds, what we call methi in Hindi. So that is a 1 teaspoon either soaked or sprouted. Thereafter, one should inculcate meditation. Meditation basically triggering the hypothalamus gland, which is just behind of the forehead. It is almond size. Basically, it controls all the endocrine glands through pituitary gland, and automatically the whole organs will get activated. Such a importance is there in meditation. Simply close your eyes, you just observe how you are inhaling and how you are exhaling. That's all. And bring the attention to this forehead also. So this is what we call vipassana, which Lord Buddha was actually defined this meditation. This can be done as per your comfortness, but generally the thumb rule is whatever the age, accordingly that much of time you have to do the meditation. Second step is after that pranayama. In pranayama, particularly Bhastrika, that is a taking in slowly, then that's what we call inhaling. Slowly you inhale and thereafter slowly exhale. So you just count 40 sets. If you do, almost it will take 20 minutes. So that is a Bhastrika. Secondly, Kapalbhati. Kapalbhati is basically massage of the internal organs. You have to eat your hair, blow to the navel portions like this. So this can be done up to 1,000 times. But those who are having BP, they should actually see their BP level and all, accordingly they have to do. Third one is Anuloma Viloma. That is a 20 sets. Taking in left side, taking out in right side. Again you taking in left side and taking out in right side. These three different types of pranayama will basically gives good exercise to the lungs. So in turn, lungs oxygen inhaling capacity will automatically increases. So this is the power and benefits of meditation and pranayama. Thereafter, you drink 1 glass of banana stem juice. Chronic kidney patients, let them have 50 to 60 ml. If at all they are having urine flow problem, if there is a good urine flow, they can go up to 150 to 200 ml. Other patients take comfortably 200 ml. Thereafter, one should have bath and all, while having breakfast, they should take flax diet as a first course of the breakfast. Then if they feel hungry, so they have to go for second courses of fruits. Further, if they are really hungry, then they can take any other breakfast items like bread and idli, roti, etc. But whereas here, kidney patients particularly and diabetes patients should not take more than 25% cereals, that is rice, roti or bread, because it's having 14% indigestible protein, which basically increases the creatine level in chronic kidney disease patients, and in diabetes patients it's having 70% of the carbohydrates, which are basically sugars. So automatically the diabetes patients will not going to get effective results from the supplements, because that carbohydrates will increases the sugar level. And further, the most important tips in the diabetes patients, they should avoid cholesterol blood thinner tablets, because automatically it will supplements from the banana stem juice and raw vegetable juice. So thereafter, before lunch, they have to take the supplements as prescribed by the doctor or dietitians, and thereafter they have to drink raw vegetable juice as a first course of the lunch. In the raw vegetable juice, as I told you, if there is a urine flow problem in chronic kidney disease patients, they have to take less than 50 to 60 ml. If there is a good flow, they can take more quantity up to 150 ml. Thereafter, the food, as I have already told for the morning breakfast how it has to be. That is a 25%, less than 25% cereals, rice and bread, and more than 60 to 70% leached vegetable food or leafy vegetable food and mushrooms. For the vegetarians, mushrooms are having very easily digestible protein. For non-vegetarians, fish is having very easily digestible protein, and also it will act like a diuretic for the chronic kidney patients. And fish flesh is like an elixir for regeneration of the cells in the dysfunctional organs. This I have experimented on my father when he was on dialysis, and I have get rid of the dialysis within 3 months when he was suffering from acute renal failure. And evening, as for the comfortness, take 1 glass of flax diet as a snacks, and also some sprouts, peanuts or whatever it is so, in a little quantity. The 2 chronic kidney patients should observe their potassium level. Accordingly, they have to inculcate it. Both fruits and peanuts In fruits, they should not take particularly banana. And you should know about the importance of the flax diet. In 1 glass of flax diet, which has been defined by Dr. Joanna Budwig, the lignans which are detoxing the cells, in the sense body, and omega-3, omega-6, which will regulate cellular metabolic activity and cellular respiratory system, which are equivalent, 1 glass equivalent to 100 kg peanuts value. So that much of power is there. Neither we can get digested 100 kg this one, nor we can consume or afford also. But whereas in 1 glass flax diet, you can compensate that much of quantum of omega-3, omega-6 lignans for the body. And dinner. Before dinner, the prescribed the supplements should be consumed, and thereafter 1 glass of raw vegetable juice, as I defined earlier. Thereafter, if they agree, then again the principle has to be followed: less than 25% cereals, there is a rice and bread, and more than 60 to 70% leafy vegetables and vegetables preparations, and up to 15% baked fish or mushrooms for vegetarians. So in this way, one has to follow the guidelines. In detail, it is in a PDF format, you can download it and you can go through the entire thing. If at all liquids are there, miracle drinks, that supplements, therein you combine together and put little water, warm or hot or any normal water, and you drink it. And in which if at all any powders are prescribed, like Edimax powder or Gravula powder, that can be added together. Thank you.